Carpal tunnel syndrome is one of the most common musculoskeletal conditions in the world. And it is essentially a condition that results from the nerve being pinched in your wrist underneath a ligament that lays across the wrist here. And that nerve shoots underneath that ligament along with the tendons that go into your fingers to allow you to flex the fingers. And that nerve underneath that ligament can get impinged upon over time with thickening of the ligament and/or arthritis in the wrist, inflammatory conditions, etc. And if you think about this space from here to here, this is the area of the carpal tunnel. Reason being is the base of that space are the bones of the wrist, and this ligament bridges across the top like this to create a tunnel. And that is why we call it the carpal tunnel. Well, carpal tunnel syndrome, again, is whenever that space gets tight and the nerve starts to get impinged in that area. So thickening of the ligament from the top and/or arthritis of the wrist from the bottom, inflammatory conditions can make this area tight, and the nerve then gets pressed upon, and that causes damage to the nerve over time. As that starts, the patients usually start to experience nighttime numbness, tingling, burning in their hand. That's most commonly in these fingers here because that nerve supplies the thumb, index, middle, and half of the ring finger. It does not supply the pinky. And most patients will initially start to notice nighttime symptoms of numbness and tingling that wakes them up at night. And then as the syndrome progresses, they start getting more and more symptoms throughout the day, start to get weakness and loss of dexterity in the hand because that nerve becomes more and more abnormal over time due to the pressure. And so treatment of carpal tunnel really involves trying to mitigate the pressure on that nerve called the median nerve. And typical initial treatment is nighttime carpal tunnel wrist splints because we know keeping the wrist in a nice neutral position at night can reduce the pressure within the carpal tunnel. Other things may be injections within the carpal tunnel, sometimes medications that help with nerve pain, occupational therapy, etc. Ultimately, the only definitive treatment for carpal tunnel syndrome is to release the pressure within the carpal tunnel by cutting the ligament that is bridging the roof of the tunnel. We have the base of the tunnel, that's the bones. We have the ligament that bridges across the top. And the only way we can definitively get rid of the pressure in the tunnel is to cut the ligament. When we cut the ligament, it's not like it's off in the breeze. Basically, there's other tissues in the area, superficial and deep. And so when you cut that ligament, it just releases the pressure in the tunnel, but then the ligament will heal in that loose state. Then the nerve doesn't have pressure on it and the nerve can continue to recover. So in order to cut the ligament, we have to get to the ligament. We can get to the ligament a variety of ways. Classically, an incision had to be made through the skin of the palm, down through that ligament because it's laying there like this, and then we would suture the skin back up, and that was classically an open carpal tunnel release. Over time, these incisions have been made smaller and smaller, and currently a lot of providers will use what we call a mini open carpal tunnel release, where it's a small incision, but it still does involve the skin of the palm here. The skin of the palm is very thick and takes weeks to heal. Oftentimes patients are out of work and/or heavy activity for 4, 6, sometimes 8 weeks whenever that surgery is performed. However, the skin on the end of the forearm here that's very thin heals very quickly. And so with carpal tunnel release under ultrasound guidance, we make a very small incision here in the end of the forearm in this very thin skin that heals rapidly. And then that allows us to enter with the device at that location and glide that up underneath the ligament of the carpal tunnel. And we use ultrasound to visualize through the skin as we're positioning the device. And initially the device is a blunt instrument. But once we have it in place and we've made sure that the nerve and its branches and the artery and all of the sensitive structures are safe and out of the way, we then deploy that knife, and then the knife pops up like a little hook knife. We then cut the ligament underneath the skin, and we make as many passes with the knife as we need to get completely through that ligament, but we do not violate the skin over top. Then once the ligament is released, we remove the device, and we don't even have to put sutures or stitches, we just put some little steri strips, which are little pieces of tape or band-aids, and we put a little bandage over it. And basically the patient is asked not to lift, push, pull with that hand more than 10 pounds for 1 week, and then they are allowed to go back to normal activity. So the patient can use the hand immediately, they just cannot do anything over 10 pounds for 1 week. And the big difference from the more classic open techniques is we're not violating the skin of the palm, which takes several weeks to heal, and that allows us to allow patients to get back to work and activities very quickly. Most individuals will return to work 1 to 2 days after the procedure, and in the event they do have a job that requires heavy use of the hand on a daily basis, we typically will hold them out of work for 1 week before allowing them to return. Prior to undergoing a carpal tunnel release, it is important that patients plan ahead of time to be limited with the hand for approximately 1 to 2 weeks. We typically do allow patients to go back to full activity at 1 week. However, they still oftentimes do have some soreness from the surgery itself at that time. So patients need to understand that and make sure not to plan the surgery right before some sort of an event or something that they would need to be feeling normal in their hand. And after the surgery is complete, the #1 priority is to keep the area clean and dry. So you have to avoid submerging it underwater. You have to put covering over the hand and wrist for showers, etc. Because the worst case scenario is to have an infection after the surgery. In the initial days and week following the procedure, it is very common for patients to have bruising and swelling and a little pain. However, as the days go by, patients routinely will start to report improvement in their numbness, tingling, strength in the hand, etc. And the vast majority of patients at 1 week post-op are very happy with their outcome and have full function of their hand and can then resume the things that they love to do on a daily basis.